I saw his name pop up. Lieutenant Governor, are you there?
Yeah, can you hear me now?
I can hear you now.
Okay, sorry, it said I was muted by the host, so whatever that means.
Yep, well, it means you're muted by the host, but you're now unmuted. And Brandy and I will turn the time over to you and Natalie to get started, and we'll circle back later in the call with the questions that we submitted to you before.
Thank you, Cameron, so much, and all of the members that are on here. We're grateful to have all of you. I do think the governor wants to join, so we're going to try to get him on. In fact, he's coming in right now. We're going to socially distance, and I'm actually going to give him the computer and the microphone. So, Governor, come in, please.
What have we covered so far?
We haven't covered anything.
Oh.
We're just starting, so you get to kick us off.
Okay. Well, thank you, everybody. These are kind of trying times. There's certainly a lot of uncertainty out there. And the question, what to do. Certainly doing nothing is not the answer. That's going to turn us into Italy. Doing something is the debate on what we should do. And if you haven't had an opportunity, we just got off a virtual press conference announcing our new Utah Leads Together plan, which has been really a continuation of what we've done for the last 3 weeks. This last week, and all hands on deck, 24 hour around the clock with some of the best brains in our state, from business, from all sectors of our economy, for small and large businesses, been engaged, our government leaders, the legislature, our executive branch, working with local governments. We hopefully have a united front with government. And certainly those involved in science and medicine, which of course have been at the forefront of this. And with that data analysis, we've done a lot of deep diving analysis. We model, looking at what's happening around the country, around the world, to see what we should be doing uniquely so in Utah in these what are virtually uncharted waters. We've never had this situation ever before in my lifetime. So the uniqueness of this is causing some issues and challenges. That being said, if you go to Utah, or go to coronavirus.utah.gov, you'll find a link to this plan of Utah Leads Together. I got a copy of it right here, you can see. And again, this is a living document. This is designed for you to take a look at it. If you've got some suggestions, some recommendations to make it better, we want to hear it. This is certainly not anything, we have pride of authorship. But we do believe this gives us a pathway forward with some certainty, some ability to, if we can get everybody to participate. This is not my plan, this is our plan. And it's an action document calling for people to take action, and everybody has a role to play. This will only work if everybody plays the role that's outlined in the plan. And if we do that, we can then, one, protect the health and slow down the spread of this coronavirus, and two, start on the road to recovery economically. And they're joined at the hip. There's not one at the exclusion of the other. First and primary, we're concerned about the health of the people, but we're also concerned about the economic health of the state. So I think we've got something that we can all rally around and see if we can work together. Lastly, let me just say, I'm not much of a one-size-fits-all guy. We get mixed reports and mixed input from people on what we should be doing. And some are saying all parts of the state ought to be treated the same. All restaurants should be treated the same. And there's arguments for that, uniformity and fairness. Maybe that's not the right policy though. So we're looking to see if there's other ideas and suggestions where we can free up opportunities to have more flexibility, maybe based on regional efforts and regional situations. That being said, we don't want it to spread, and we've got to do what we can to keep this coronavirus in control. Last but not least, some good news. The biggest challenge we've faced as a state, which has been a nationwide challenge, is in fact testing, or the lack thereof, for a variety of reasons. And again, we're not going to point the fingers at who's to blame. It's just been the reality in this country. We have not been able to test as much as we need to do. We were testing just a few hundred a day last week. I'm proud to tell you that yesterday, we did 2,625. 2,625 yesterday, and we're starting to ramp up the efforts we've made to increase testing. We're seeing the fruits of our labor now, and more testing. We're going to increase the capacity there. We appreciate those who have stepped up to help us in that arena. Certainly the University of Utah and ARUP, which has done some really great work in a bigger lab and opportunity for us to test more, opening up 4 new locations around the state. Intermountain Healthcare, which is opening up 19 side services for testing. Right now, anybody who's got the symptoms, get a referral from your doctor, should be able to get in and now get tested. We're not at the point where anybody wants to get one just to find out if they're sick or not, but if we can ramp up enough, we hope to get to that point maybe in a few days or next week. That being said, this is going to help us identify who's got the coronavirus, to isolate them and be more strategic in how we, in fact, do things and develop policy. That, again, is going to allow us to isolate those who have the problem and free up those who don't have the problem, which will help us to improve economically. So again, that's good news today. I think mostly the plan is great. Take a look at it, read it, give us your input. We're all in this together. We all have a role to play. Let's make sure we play it together and do the best we can to make sure that those we represent, the constituency out there, also understand and play their role, and don't ignore the rules, but play by the rules. Thank you. Good luck.
Thank you, Governor. This is Cameron Deal again with the League of Cities and Towns, and thank you for the comments on the press conference and for the overall leadership on the plan. Before the two of you joined the call, Brandy Grace and I explained that we have participated in the Recovery Task Force. We have League members that are participating in the different subgroups that have started meeting to now work on the implementation of the task force plan. And so thank you for the overall leadership in taking a comprehensive approach. One thing that you said in the press conference that I want to reiterate to the 225 local government officials on the call right now is that this is the most comprehensive plan of any state in the country in trying to address coronavirus. And I think that's a tribute to the overall leadership and to the special sauce here in Utah. Natalie, we have you on the call. Lieutenant Governor, we have you. We had some questions prepared, but I also want to give you a chance to discuss any additional details around the plan that just came out.
So I think what we would like to do, Cameron, is to use Natalie right now to go through the details of the plan. And while we've got her, let's use her.
Sounds good. Cameron, can you give
Perfect,
me a
Natalie,
thumbs up?
take it away.
All right, can you give me a
Yep,
thumbs
take it
up
away.
that you're hearing me okay? All right, great. Cameron, one quick question for you. Do you want me to put up the plan on the screen or no?
Both UAC and the League will be distributing it after the call today. So you could put it up for those who are participating via video, but we're about half and half on who's video and who is on the call. So plan accordingly.
Okay, sounds great. Thanks. Thanks, everybody. Thanks, Cam and Brandy, for your assistance with the plan and for the invitation to help out. Thank you, Lieutenant Governor, for your leadership. I'm going to be really brief and let the questions kind of fill out, but I think the key thing that everyone needs to know is that over the past 6 to 10 days, a very remarkable collaboration has occurred between almost 100 individuals on the Economic Response Task Force and Industry Resource Committee. Many of you are represented in some way in that. And the collaboration resulted in what's called Utah Leads Together. It's important that you know that this is a dynamic plan. In other words, we expect it to change over time. It's informed by data, the good news that the governor shared about testing. And it represents a unified plan that if we all rally behind it, it can be a big part of accelerating our health and economic recovery. I'll also just emphasize that there was a clarion call in the business community for a plan, for something that was directionally correct. We operate in an environment of uncertainty. There's no way we can know with precision, but there are some things we do know. And one of the things we know is that economies, when they struggle, they have an urgent phase, and then they have a stabilization phase, and then they have a recovery phase. And this plan is organized along those lines. And so for those of you that are seeing the plan, the goal is to provide Utah businesses and residents with clarity and specifics about our health and economic recovery. The plan says that to be successful, we have to take 3 actions: rigorously follow public health guidelines, stay engaged with the economy, and assist those in need. And it's the belief that if we pay attention to those 3 items, we will have less suffering in our state, and we will have a quicker return to prosperity. I will jump now to just some of the details about these phases. The urgent phase, we expect to last 8 to 12 weeks. It started on March 16th. In the urgent phase, we have some very important public health practices that people are doing. We're increasing the testing. They're doing contact tracing. High-risk populations have been asked to stay at home. A lot of other restrictions, whether it's group gatherings and the like. But a major message of the plan, and I'm sort of highlighting it for those that can see it here, is that the Utah economy is open and operating in compliance with specific public health practices. And we do list every single major industry in the state, a message from the state that we are open. The catch is that we have to follow specific public health practices. And we do have some industries, largely small businesses, that are operating under specific restrictions, and they're listed here. I'll come back to that in just a second. The urgent phase also includes, and I'm sort of highlighting them here, a massive public and private response to this public health imperative. This includes monetary policy, fiscal policy, the need for state and local government to do their part, and then for the private sector to innovate and do their part as well. This particular urgent phase has a very detailed work plan that's being managed by the Governor's Office of Management Budget. It uses transmission rate measurements to trigger different public health activities in our state, ensuring public safety, but also allowing us to target as best we can the economic activities that are appropriate. I'm going to just highlight that there's a stabilization phase, and we expect that to last 10 to 14 weeks. It has a little different characteristics, and then a recovery phase that once again begins to ramp up a time when we will have the virus under control and job growth returning to our state. For those of you that can see on page 8 of the plan, we reference how to stay engaged with the economy and provide general guidelines for the entire economy about how to conduct yourself in this public health emergency, and actually give specific guidance for retail, manufacturing, dining, work sites, whether it be manufacturing, construction, even hotels and accommodations. So this is a lot of clarity, and this is what business has been asking for. And then finally, at the end of the plan, we provide resources for small business owners and employees. We have a data appendix that helps people understand that in a fiscally prudent state like ours, we have historic balances in our rainy day funds, in our working rainy day funds, in our unemployment insurance trust fund. This is exactly what these things are for, to help us in a time of need. And then we also do an accounting of what the monetary and fiscal response has been at the federal level and Federal Reserve level. And then I'll just show at the end here, here's a listing of the entities that were part of this plan's creation. So with that as background, I'll pass it back to you, Cameron, or to the Lieutenant Governor.
Perfect. Lieutenant Governor, would you like to chime in?
There we go. Yes, thank you. And Natalie, thank you for tremendous work. I mean, this is the stuff of legends, how quickly you were able to bring everybody together and move this forward. So I can't thank her team enough. I just want to reiterate just a couple things that are really important. This concept that we either have to save lives or save the economy. That's not how we do things in Utah. That's a false choice. We can do both of these things, and that's what we're all engaged in together, and that's how we're going to do this. Now, this only works, and I want to talk about that urgent phase just a little bit. The governor mentioned the importance of testing. This is what we've been just focused on. Everything we have been doing is around testing, and there's a reason for that. If you look at other countries and what has happened out there, the only real solution, well, there are two. One is we can continue to lock things down tighter and tighter and tighter. And that is one way to prevent the spread of this. That's a very blunt way of doing it. What we want is what we saw in South Korea, and that's a much more surgical approach. What they were able to do is, with extensive testing, they were able to find out who had the virus, and then people that were even asymptomatic who had been in contact with those people, and being able to quarantine them on a much more surgical, with much more precision, then we can prevent the spread of this without having to further lock down our economy and everyone else. And so that's really what we're working for. However, we can't do that until we get testing at an even greater rate than we have now, going to 2,600. By the way, the most we did last week in any day was 500. Today, we'll be able to test over 2,600. That's a huge jump, a bigger jump than any state has been able to do in such a short amount of time, especially a state of our size. And so that's going to give us an opportunity to really understand. We've had to make decisions a little bit in the dark because we knew it was spreading, but we just couldn't figure out how much because we didn't have enough testing. Now, we do know, as the governor mentioned, that means our numbers are going to jump up, and they're going to jump up pretty rapidly. But that's a result, again, of finding out where the disease is and then trying to get people out of circulation. And so we really need people, though, to continue to social distance. And that's why these guidelines that are in the plan are so important for those businesses that are open. We want to make sure that you're using best practices and that we can keep commerce going without infecting each other. And with that, we're happy to answer some questions.
Lieutenant Governor, this is Cameron again. We have had a bunch of questions that have come up this afternoon. We also submitted some questions to you in advance. I recognize that the questions we submitted in advance were very specific. Let me ask one question that we submitted to you in advance, and then Brandy has questions from the association, and then we've been getting some questions around today's plan, and I'll come back to that in a moment. Does that work for you? Okay. So we've had a lot of questions since the declaration yesterday that schools will be out of session and will be homeschooled through May 1st around the issue of playgrounds. You have county-owned playgrounds, city-owned playgrounds, private playgrounds, school-owned playgrounds. We have spoken with many cities around the state who have been doubling their efforts to improve the sanitation of playgrounds. Notice I'm not talking about the full park, but specifically the structures where you see the social gathering, particularly of kids, and you have these surfaces that are difficult to keep clean. You also have playgrounds right now that are at schools where they may not have that same level of sanitation that you're seeing at the city and county level. Has there been discussion within your office and with the governor around playgrounds, or is that something where right now you're leaving that decision to local government?
Yeah, thank you, Cameron. So I just had a quick conversation with the governor's chief of staff on this one. We haven't had a broader discussion on it. As you can imagine, there are lots of questions around this. And while the bigger policy questions the governor and the task force have been weighing in on and giving recommendations, this is one that is being left up to local communities and local health departments working with your local communities. Again, we just give some practical guidance where we can be careful and keep sanitation. We want to encourage people to get out and with the appropriate distance and to take advantage of the hopefully what will be better weather here soon. And however, if there are large congregations, that's where it does become problematic. And as our state health department, our epidemiologist said that our kids, although they don't seem to get very ill with this, they are kind of perfect little vectors for being able to spread the disease. And that's where we want to be careful. So we would urge proper sanitation wherever possible, but we will leave that up to local decision makers.
Brandy?
Yes, thank you, Lieutenant Governor. Is there a reason for individual counties to declare a state of emergency?
We've gotten that question a lot. We've gotten it from individual cities as well. Everyone will be subsumed within the state's emergency declaration. Now, it does within your counties. It may give you some latitude on some of the some of the rules that are there. You will have access to all of the funding that is coming from a federal level without having to do that. So it's not necessary. But some may choose to do that, and we would just encourage you to work with your local council, your county attorneys on whether or not they feel that that's necessary for your specific county. But there's no direction from a state level that everyone should be doing that.
Thank you, Lieutenant Governor. One question that has come up a lot in the last hour since the release of the plan has been just the overall time frame of what the modeling looks like for the virus to, I even hesitate to use any word that references it'll be resolved. So let's, you acknowledge that testing is going to increase. We're going to see more people who are diagnosed and test positive. We have been keeping track of those who are residents and those who are non-residents. We've heard from some of our communities who are concerned that they are tourism centers and they have a lot of people coming and going. What is the communication between the labs and the state and a community like Alta or a Moab if there is a visitor who tests positive, but tests positive while he or she is in one of those communities?
Yeah, so I'll try to address those. Part of the unfortunate part of this is that with a novel virus like this and no treatments yet, I always like to use the yet. There is a potential treatment out there. We talked about that that has shown some promise, and we've made that available to doctors in the state to be able to prescribe to patients that have it. But we don't have any specific treatments directly to this virus, so that makes it a little difficult to predict exactly what's going to happen. We can look at what's happening in other countries. All of those models are different depending on how good we are at social distancing and washing our hands and keeping away from each other. If we can, really what we're trying to do is if every person that gets this disease spreads it to two other people, then you get exponential growth, right? And that overwhelms our hospitals very quickly. If it's a one-to-one spread, we end up keeping things flat, but still really putting pressure on our systems. If we can get below a one-to-one transmission, that's how we beat this thing. And that means when we get sick, we have to stay away from everyone. Even if we're not sick, we may have it, we have to be careful. And so that's really going to determine how quickly we can move through these phases. We're very hopeful that in the next 8 weeks, 8 to 12 weeks, we have seen that in some countries where they can get on top of this quickly. We are a younger population here. In Utah, we're a little less on top of each other, and so those things are all helpful and weigh in our favor. If things go very badly, like we're seeing in Italy, it becomes tough to know how long that will last. When it comes, so I talked about the increase in testing. The other piece of this that is really important is an increase in tracing. So you have to find, if every time somebody is diagnosed with the illness, then we have to try to find out everyone that they've been around and had direct contact with. That's where our local health departments are so important. And one of the things we want to do is increase their ability to trace trace the contacts that happen, and that means helping them, getting them some funding so that they can actually hire more people to do this type of work. But HIPAA laws do not apply in the same way for our county health departments, and so if there is an outbreak, they do contact the places where the person has stayed, the places where the person has had direct contact, and that happens very, very quickly, and is critical for us to trace that down and then test those people to see if they have it or not. And if they do, then we can quarantine more people.
Terrific. Thank you, Brandy.
Yes. If at some point business activity is limited to essential services, do counties have the ability to declare certain business activities as county services, essential services within their counties, or does that designation come from the state or some other one?
That's a good question, Randy, and it's not an answer I have. That would be more of a legal question that we would want to work through. My guess is that it would probably come from a statewide declaration. And let me be very clear: we do not want that to happen. We're doing everything possible to make sure that that does not happen. And the way to stop that from happening is everybody has to take this very, very seriously, so we don't have to do what is being done in other states. However, I will say this, that we will, if we get to that level at all, we will have communication with you, with leadership from across the state to make sure that we are very careful about what we designate as an essential service or not, so that we'll obviously want to be broad, but careful in doing that. And there are lots of examples of states that have done this already. I think there are 13 states that have done it so far. But if Utahns, if we really work hard together, we hope not to get there.
Thank you.
Perfect. Thank you, Lieutenant Governor. This question, speaking of experiences in other states, we've seen conflicts occur between the federal government, state government, and local governments around potential community locations for large-scale quarantines. This was particularly prevalent when cruise ships were returning to the country, and there was a dispute or a battle over whether or not the ship could dock somewhere and where those patients would go. There were two specific examples, one in the state of California, one in the state of Alabama, where local government was not consulted when a site was essentially commandeered to be a local quarantine site. Has there been discussion yet around potential community locations? And if so, what's the plan for the state to coordinate with local government and first responders around those potential sites?
Yeah, so thank you. The good news is we haven't had any of those major types need for quarantine, and it's less likely that we will day by day in a couple senses, and more likely in others. Let me just share those. So because of the limitation that President Trump put on mass gatherings, encouraging us to limit those to 10 or more. All of the big groups that were in the state of Utah aren't here now, by and large. So the big tour groups that were coming in, we had worked with Salt Lake County on a hotel that we could use, a hotel that was vacant that we could use for a type of mass quarantine if that was necessary for big groups that were traveling and were here. So the odds of that piece happening, like happened with the cruise ship and those types of things, is actually pretty minimal right now. Where we do potentially run into to possibility for something like that would be in and around our homeless shelters and that community. And so we will any of those conversations will be done with local medical officials and first responders as well. I know that the initial conversations, just as far as what that would look like for any type of need for mass quarantine sites, usually centers around hotels that now unfortunately have lots of vacancies since people aren't traveling and aren't coming to our state like they were before. But those are conversations that would happen between public safety, local officials, and the hotel to figure out what the best options are.
Thank you, Brandy.
Yes, thanks, Cam. Lieutenant Governor, spring break is right around the corner, and our rural counties especially are concerned with the influx of visitors to their communities, especially considering the very limited resources that they have available. Will the governor's office emphasize a policy of stay home, stay healthy during this time when people are more inclined to travel? And the second question, a follow-up question, would be, will the Utah Office of Tourism participate in this effort?
Yeah, it's a good question. I don't have to answer all the questions. If there's anybody else on here that wants to answer, I don't know if we have anybody from our state health department on or not. But I don't. We do want to be careful again with mass congregation. That's really where we're seeing the issues. And it's interesting. I have county commissioners saying stop people from coming to our county, and county commissioners saying whatever you do, don't stop people from coming to our county. And so those are conversations that are being had and still need to be had. And I think all of our universities are done with their spring breaks. Many of our school districts, local school districts, are done with their spring breaks, but we know that there are more that aren't. There are some coming up. My kids are on spring break right now, and they're deep cleaning at home. They're not very happy with us. But we, we're not stopping people's movement and their vehicles from traveling through the state, but we are encouraging them to be very, very careful. And again, the same rules apply whether you're here or whether you're at your second home in St. George. You need to follow those same rules with social distancing and being careful about spread.
Thank you, Lieutenant Governor. We have a question here around first responders and essential employees. You mentioned that the testing is increasing, in the case of today, 5-fold from where we were last week. Is there a process for first responders in particular, but for first responders and essential employees, even if they don't have symptoms, to still be tested to make sure that those first responders are available to provide public safety in communities?
Yeah, that's where we want to that's where we want to go. So first of all, let me say this: first responders have been and should be, if we have any examples of that not happening, please let me know, have always been a priority when it comes to testing when they are showing symptoms. And that continues right now. So before, we couldn't test. We had so few tests that we could only test if you had traveled to a country where you were potentially exposed or they had a high rate of exposure, or you'd come in direct contact with somebody that had. We prioritized also our medical professionals and first responders, as well as those in nursing care facilities, because we know how damaging that has been, as what happened in Washington. So that has always been a priority for anybody exhibiting symptoms. Now with the change today, anybody exhibiting symptoms, their healthcare provider can refer them to get tested. We're not quite at the phase where asymptomatic people are getting tested, even our first responders. However, if we have a first responder who has come in contact with someone who has the disease, that should be prioritized. And so that answer is yes. And let let the healthcare professional know, or where you're going to get the test, that you are a first responder and that you have had contact. And even though you're asymptomatic, you need to be tested. We should be able to make that happen now.
Thank you, Lieutenant Governor. Brandy, your question?
Yes, thank you. We now have information from the Economic Recovery Task Force, and certainly we can be sharing information as we have been with our members on what they can do. But Lieutenant Governor, do you have other suggestions for local elected officials on what they might do to help small businesses in their communities survive this?
Well, we've seen some really good examples from some of our small communities about what people are doing to rally the community around the small businesses. And what I would say is that you all have a microphone, and you're trusted individuals with that community, and we're encouraging our entrepreneurs to think outside the box as best they can. It's important to point out, this is a global economic issue. And even if Utah had done nothing, just the changes that we've seen in the rest of the country and the rest of the world would have brought a significant slowdown to our state. Right now, we haven't ordered the closure of any businesses. The most directly impacted, of course, are food services without dining in, and we know that that's huge and it's crippling for so many of them. But what we're hoping to, what we would love to see is, I think today is National Takeout Day, and we're seeing communities rally. We've seen it in Salt Lake, we've seen it in Cache Valley, Utah County, where those restaurants are all coming together and supporting each other with curbside delivery or curbside and home delivery methods. So that's what we need to do. Again, there's a federal piece to this, and Natalie may can speak more to this, but we're hoping to get that. We talked to Senator Lee and Senator Romney yesterday, hoping to get those congressional packages done, because there are really important pieces of this that will help our small businesses. There's a big piece in that for small business loans to keep the doors open, and those loans can be forgiven at the end if they're able to keep the employees hired and keep them on the payroll. And so that may be enough for a couple months to keep people in business if we can get this done quickly. But at the local level, it really is about encouraging people to, and making sure that we're not slowing down business. If there's a regulatory piece to what we're doing, let's examine it and see if we could alleviate that regulatory piece for a couple weeks or a couple months. Make sure that if there's not a backlog of approvals for construction or home, whatever it is. Let's make sure that we're on top of that, so that we're not the source of slowing down some sort of economic activity.
To that end, Lieutenant Governor, there was an article in the Deseret News this morning talking about how city halls were open for business. We did a survey with our cities around the state last week, and it was inspiring to see the number of cities, and frankly every city, who immediately got to work implementing the governor's recommendations, providing for the public services that the residents expect, but also protecting public health. And so in addition to the task force document that we'll be sharing with our members today, we've also put together a list of best practices at the local government level that have come from our members over the last few days.
That's incredible, and we can't thank you enough. We've heard so many wonderful examples of people going above and beyond, finding new ways to do things. We're working through this. It's really been incredible. And I'll tell you, my office, we're having the same issues. Just got notification today that there's been some problems with notaries, and people aren't wanting to come in to do the in-person notary. We did last year change the rules to allow for remote notarization, but we're looking today to see, is there an easier way that we could allow notaries to do their work so that they can close deals that need to be closed, and maybe do it via FaceTime and without having to all come in and register as remote notaries. So that's the type of thing we're doing, and you guys have been just on top of that, and we're so grateful for it. So thank you.
Yep, absolutely. Now, yep, go ahead.
No, I just say maybe time for one more question.
Okay, so that was a statement rather than a question. So can Brandy and I each do one more?
Yeah, sure.
Okay, perfect. So one question that's come in from cities over the last couple of hours since the release of the plan is that this appears to be Utah's attempt to not go to shelter in place, but to provide concrete steps for residents, businesses, and others, take the recommendations from a couple of weeks ago to that next step without going to the shelter in place orders that we've seen in other states. The question has come in though, is how often is that going to be reevaluated, and how often will the different benchmarks in the plan be looked at in order to potentially make other decisions as we go forward?
Yeah, Natalie, do you want to jump in on that? I will too, but if you want to, we could unmute Natalie and maybe she could talk about reevaluating the plan as we move forward.
I think you're hearing me now. Yes. Okay, great. The way I would respond to that, Cameron, is right on the front page of the plan. Front page, not even inside it. It says the phases, measures, recommendations, and other details will be monitored daily and updated as required. The Speaker of the House in the earlier call emphasized that we are in a critical stage where we are focused intensely on the next 10 days to 2 weeks. And so the dashboard that's been set up, the measurement that's been set up is intended to guide all of these public policy actions. And yeah, I'll turn it to Lieutenant Governor now, but this is not a weekly thing, a monthly thing. This is an hour by hour thing that the state is focused on.
Thank you, Natalie, and I would just concur with that. We, over the past 2 weeks, and look, you guys, I just so appreciate your patience as we worked through this. This is unlike anything any of us have experienced in our lifetimes. I usually we talk in hyperbole. This is the worst ever, the best ever, but this really is unprecedented, and we are living through this at our level here, minute by minute. It's just incredible the way people are coming together and the decision making that is having to take place. Sometimes we're slow to respond to you. Our deepest apologies. It isn't because we don't care. It's because the crush of information and decision making is just overwhelming, and people are coming together. So what I would say is this. This testing piece is going to be so important to inform our decisions. The hope is that as we broaden testing, we'll realize, hey, maybe this isn't as widespread as we thought, and we can, we can adjust accordingly. Conversely, we may find out this is much more widespread than we thought, and our ability to tighten things up, we'll have to consider. But Cameron, your point is very well put, and that is that this is an attempt to avoid some of those more stringent things that we're seeing elsewhere. But it is going to take all of us, and we will be reevaluating daily. Every day I think, okay, we've got this, and then tomorrow 10 things change. And that could happen tomorrow. And so we just have to be prepared for that. But what is so brilliant about what Natalie has done and the governor and others through this is that it's giving us goals. The economy functions with certainty. That capital's a coward. It always has been. And when we as human beings perform much better when we have goals and we're driven to something. And that's what we're driving to here. This is a call to action for every person in our state. Every single person has a role to play in this economic plan. While it's addressed to business, it really is addressed to every Utahn, because if we're doing our job, which sometimes our job means sitting on the couch and watching TV. Sometimes that's our job. Sometimes that's the most heroic thing you can do right now. If you're not feeling well, is isolate yourself from everyone else. But that is how we are going to get through this. That's how we're going to meet these goals, and that's how we're going to get out of this quicker than any other state.
That's terrific. Thank you, Lieutenant Governor. Brandy, final question?
Thank you so much. And I just want to, before I ask the final question, I just want to say how much our membership appreciates these calls, Lieutenant Governor. Not only do they get an opportunity to ask the questions of you, but in hearing the questions, we believe that you're more mindful of kind of these different specifics that are going on in our rural communities. So thank you, and thank you to the League for partnering with us on accomplishing this. Final question, and I've heard this from several of our county commissioners, and that is, obviously, local eateries are feeling the brunt of this, and there seems to be a bit of confusion where the public is being prohibited from going in and dining in, and yet at the same location, we have a lot of convenience stores, travel stores where there may be a dine-in option as well as a hot food buffet where they can get food, and you've got people lined up in the queue, and so there's becoming a bit of tension between restaurant owners and those travel stores, convenience stores, where they're essentially doing the same thing. There seems to be some different classification there. And so the question really is, can the state provide additional clarification on those situations, and can local governments be involved in those conversations to further clarify what's appropriate and what is not?
Yeah, I think that those are conversations that definitely should be had with our LHOs, our local health departments. Again, impossible to look at every situation and make an individual decision, but we certainly don't want to just move the problem from one location to another, because again, that's not going to help us get through this. And we do have to keep commerce going. We need our gas stations open. People do need to be able to get food, but we have to be really careful that we're not all congregating and spreading that virus. And so yes, I would encourage those discussions to happen at the the local level. And if we need further clarification at the state level, I'm happy to talk to our state health department about that. Thank you. Let me just conclude by thanking your membership. Look, I've been a mayor, I've been a city councilman, I've been a county commissioner. I was a mayor and a county commissioner during very difficult times, during the Great Recession, when we had wildfires that evacuated our town. I know how tense this is. You are at the front lines. You get the questions from your constituents. You can't go to the post office or the grocery store because there are 50 people who take 2 hours of your time and expect you to have all of the answers. And I know how frustrating that is when you don't have all the answers. And we're really focusing on doing a better job of communicating. That first week was just so intense that sometimes the communication piece got lost because we were just putting out fires and solving problems. Now we're getting into a more operationalized phase of this. We've built up teams. I think we have 12 different subgroups that are working on every facet of this issue as it grows throughout the state. And we're just thankful to all of you for what you're doing. Thank you for leading. Thank you for your patience. Thank you for working together. And let's keep talking. Thank you.
Perfect. Thank you, Lieutenant Governor, and thank you to your team. So that everyone on the call is aware, and both Brandy Grace on behalf of the association and me on behalf of the league are involved in several of the different subgroups that the Lieutenant Governor just referenced. We are also members of the overall Economic Recovery Task Force and the Coronavirus Task Force. So as questions arise, whether they are legal and technical in nature, and we had several of those that we didn't get to today that we'll follow up with state leaders about, or the bigger policy or communications questions, please share them with us. We'll make sure they're being shared with the highest levels of the task force. Lieutenant Governor, thank you to you and to your staff for their responsiveness. These conversations are happening 24 hours a day as we all try to react and be proactive about what's here and what's coming next. Perfect. Thanks, everyone. We will let you know when the call will happen next week.
Thank you, Cam.
Brandy?
Thank you.